Did you know that in just seconds, spotting the difference between a heart attack and a stroke can save a life? Mistaking one for the other could delay critical care and cause lasting damage. Every minute counts. Stay with us for the next 18 minutes to learn how to recognize key signs, act fast, and prevent these emergencies to protect yourself or someone you love. You are not alone. We know you're here because you care deeply about your health or a loved one's. Perhaps you've seen someone collapse unexpectedly or worry about yourself as you age. That fear is real. Let's walk through together how to identify and respond to these emergencies with confidence. Before we begin, a vital note. This video is for educational purposes only and is not medical advice. Always consult a qualified healthcare professional, then for diagnosis and treatment. In an emergency, contact your nearest medical center or local emergency services immediately. Your safety is our priority. Let's answer the big question. How are strokes and heart attacks different? Both are medical emergencies, but they affect different parts of the body and have distinct symptoms. Knowing the difference helps medical teams prepare the right treatment faster, potentially saving a life. What is a heart attack? A heart attack or myocardial infarction occurs when blood flow to the heart is blocked, often by a clot or plaque in a coronary artery. Without oxygen, heart tissue begins to die, which can lead to severe complications or death if untreated. According to the American Heart Association, over 800 heart attacks occur annually in the US alone, with many preventable through lifestyle changes. What is a stroke? A stroke happens when blood flow to the brain is interrupted either by a clot, called an ischemic stroke, which is most common, or a burst blood vessel, known as a hemorrhagic stroke. Without oxygen, brain cells die within minutes, potentially causing permanent disability. The CDC notes that strokes are a leading cause of long-term disability, but rapid treatment can minimize damage. Time is critical. Time is heart. Time is brain. Common risk factors. Both conditions share risk factors, especially for seniors. High blood pressure damages blood vessels, increasing clot risk. The NIH reports it's the leading risk factor for both conditions. High cholesterol builds plaque, narrowing arteries, restricting blood flow. Diabetes harms blood vessels, raising clot risk by 2 to 4 times per the CDC. Smoking damages vessels and raises blood pressure, doubling stroke risk. Obesity or sedentary lifestyle contributes to high blood pressure and cholesterol. Family history increases risk. If relatives had early heart attacks or strokes, age risk rises after 65, with 75% of strokes occurring in this age group. Atrial fibrillation, or AFib, an irregular heartbeat, can cause clots, increasing stroke risk by 5 times per the American Heart Association. Knowing these helps you work with your doctor to prevent these conditions through regular monitoring and lifestyle adjustments. Early warning signs and atypical symptoms. Sometimes heart attacks and strokes present with less obvious symptoms, especially in seniors, women, or those with chronic conditions. For heart attacks, women may experience nausea, jaw pain, or extreme fatigue rather than classic chest pain. The Mayo Clinic notes, women are 50% more likely to have atypical symptoms, which can delay treatment. For strokes, early warning signs, like a transient ischemic attack or TIA, a mini stroke may cause temporary numbness, dizziness, or vision changes that resolve within hours. These are critical red flags, as 1 in 3 TIA patients may have a full stroke within a year per the NIH. If you notice unusual fatigue, confusion, or mild weakness, don't ignore it. Seek medical attention immediately. Heart attack signs: heart. Age, heavy chest, intense chest pain or pressure, like a heavy weight. It may spread to shoulders, arms, often the left, neck, jaw, or back, lasting several minutes. E, exhaustion, sudden, extreme fatigue, especially in women, like running a marathon without moving. A, air, shortage, shortness of breath, even at rest. R, radiating pain spreading to arms, neck, or jaw. T, time, contact your nearest medical center or local emergency services immediately. Do not drive yourself. Stroke signs: FAST. F, phase, sudden drooping or numbness on one side. Ask them to smile, one side may not move. A, arms weakness or numbness in one arm or leg. Ask them to raise both arms, one may drift down. S, speech, slurred speech, or trouble understanding. Ask them to say, the sky is blue. T, time. Contact your nearest medical center or local emergency services immediately. Note the time symptoms started. Additional sign: a sudden, severe headache with dizziness or weakness may indicate a hemorrhagic stroke. What can loved ones do before medical help arrives? Based on medical guidelines. For a heart attack, keep the person calm, seated, or lying with head and shoulders slightly elevated. Loosen tight clothing. Do not give food or drink, as it risks choking. Monitor breathing or pulse if possible. Only give aspirin if instructed by a medical professional. For a stroke, keep the person calm, lying flat with head raised about 30 degrees, unless showing signs of shock. Do not give food or drink due to swallowing risks. Note the time symptoms started critical for treatment. Reassure them calmly. If unconscious, place in recovery position to prevent choking. In both cases, contact your nearest medical center or local emergency services immediately and describe symptoms accurately. A story from Munich. Anna, a 70-year-old grandmother, was gardening when she felt crushing chest pain. Thinking it was indigestion, she ignored it until sweating and fainting began. Her son quickly recognized the heart attack signs and contacted emergency services. It was a heart attack, and his swift action saved her life. A story from Lisbon. João, a 68-year-old retired teacher, was walking with his wife when he suddenly felt dizzy and one side of his face drooped. His wife, having watched a CareWise seniors video and recognized the FAST signs of a stroke and called emergency services. Doctors confirmed a TIA, and João received medication to prevent a full stroke. His wife's quick action, informed by shared knowledge, made all the difference. Anna and Joan's stories teach us a profound lesson. Life is fragile, and our bodies send signals we must heed. Heart attacks and strokes are more than medical events. They're reminders to cherish every moment with loved ones and prioritize our health. True wisdom lies in acting decisively when it matters most. Today, talk to your family and community about these signs. Turn this knowledge into a legacy of care and preparedness. What can you do today to stay prepared? Step 1. Memorize F, A, S, T, and heart. Write them on a note and pin it to your kitchen or fridge. They're your quick guide to spotting a stroke or heart attack. Practice saying them aloud with family to make them second nature. Step 2. Share this knowledge with family, friends, or neighbors. A 5-minute chat over coffee could save a life. Practice recognizing signs together. Ask someone to smile or raise their arms to build confidence. Supercharged tip. Build a daily body check habit. Every morning, take 1 to 2 minutes to tune into your body. Sit quietly and notice any new chest discomfort, shortness of breath, dizziness, or weakness in one arm or leg. Say, "The sky is blue," to check speech clarity. Raise both arms to test balance. If you know how, check your pulse by counting beats on your wrist for 15 seconds. Irregularities may signal issues like atrial fibrillation. This habit, backed by the American Heart Association, helps you spot early warning signs like a transient ischemic attack or TIA, a mini stroke, which may cause temporary symptoms but signals a higher stroke risk. If you notice TIA symptoms, even if they pass, seek medical help immediately, as the NIH warns. 1 in 3 TIA patients may have a stroke within the year. Bonus prevention tips. Reduce your risk with these science-backed habits. Move daily, walk 30 minutes most days to strengthen your heart. A brisk walk in your neighborhood or park can lower blood pressure by 5 to 8 mmHg per the CDC. Eat Smart include 5 servings of fruits or vegetables daily. Try a breakfast smoothie with spinach and berries, a lunch salad with avocado, or an apple as a snack. Limit processed foods and salt to under 2,300 mg daily to protect your arteries. Manage stress. Try the 4-7-8 breathing technique. Inhale for 4 seconds, hold for 7, exhale for 8. Practice it twice daily, in the quiet spot, sitting comfortably, focusing on your breath to lower stress hormones, which can spike blood pressure per Mayo Clinic studies. Regular checkups monitor blood pressure, cholesterol, and blood sugar with your doctor. Ask about a phleb screening if you're over 65, as it's often silent but treatable. Stay connected. Join a local walking group or health workshop to stay motivated. Social support can reduce stress and encourage healthy habits, per the American Heart Association. These steps empower you to take control of your health and live vibrantly in your golden years. You are the guardian of your health and your families. This knowledge is a gift. Share this video with anyone who needs to know. It could spark a life-saving conversation. In the comments, tell us how you are applying these tips or share your story. It inspires us all. Want to learn more about staying healthy in your golden years? Subscribe to CareWise Seniors and hit the bell to never miss a video. Next, don't miss our video on how to build a daily body check habit for heart and brain health. Start a family health challenge today. Commit to a daily walk or a body check and share your progress with us. Always consult a doctor before acting on health information. Together, let's build a community of care and live healthier, fuller lives.